Hello, my name is Kevin D'Angelo. I'm a sports specialist chiropractor. I work at McMaster University at the David Braley Sports Medicine Center, and I also work in the Halton region at Velocity Sports Medicine. I also represent the College of Chiropractic Sports Sciences in Canada. So chiropractors are primary healthcare practitioners that are experts in musculoskeletal pain. So issues with the muscles, bones, ligaments, and biomechanic issues in the body. Chiropractors like myself who hold a board-certified specialty in sports medicine, we deal with sport-related concussions in a more advanced role and have clinical training and management protocols that can be used in these scenarios. So chiropractors have board-certified training in both the clinical assessment and management surrounding concussions. Chiropractors are best suited to deal with the somatic or physical symptoms of a concussion. These may include things like headaches, dizziness, nausea, poor balance and control, and issues with their vision. They also may have issues with just general aches and pains that happen during a concussion. A lot of times this occurs because things like whiplash and trauma to the neck can occur in the same time a concussion is experienced. One of the best evidence-based strategies early on is education and reassurance for that person going through a concussion. That's typically where we start. Another place we start is trying to establish exercise tolerance for that patient. This is usually done with the Buffalo Concussion Treadmill test, where we try to see how much we can get an individual to exercise without bringing on their concussion symptoms. We also look to see how the neck may be involved in terms of headaches, dizziness, and nausea, and how their balance and coordination is affected. We also will help to refer them to other professionals within our network and take a multidisciplinary approach to solving concussions, as these are challenging and best treated with several specialists on board. As a sports specialist chiropractor, I work along with sports physicians, athletic therapists, sports physiotherapists, and the strength and conditioning staff or performance staff with the team. We're in a clinical setting. A lot of times we'll work with the family physicians and nurse practitioners involved in a patient's care. Sometimes this will include people like emergency physicians, where people are being diagnosed with a concussion at the hospital and then seeing us later. A lot of times we also work with neurologists and neuropsychiatrists that have been referring patients our way. But generally anything that falls outside of my scope of practice, whether that be red flags we pick up in the history or prolonged symptoms dealing with cognition issues and sleep issues, or general health related questions, we usually send people back out to their family practitioners. Can have a variety of ways that somebody would see me for a concussion. Sometimes there is no referral and somebody will walk into my office. I'll be the first point of contact. In other cases, I'm also referred to from people like family physicians and sports physicians. In other cases from the hospitals directly, sometimes nurse practitioners or emergency docs that are on site. And even in a chance we'll have people that come from allied healthcare practitioners.